Welcome to the fourth edition of the Orange City Area Health System COVID-19 Community Briefing. Welcome. We're glad you've joined us again for today's briefing. Today joining us is Liza Schouten. Liza wears a number of hats in this organization and has for the last 17 plus years. One of the things you probably notice on our guests that we've had is Liza is the junior tenure person so far at 17 years. And so one of the things that we really boast in the health system is longevity of employees. And I think that speaks large to how we're responding to this environment, the expertise that we have. And if the least tenure person is 17 years so far, we're probably in pretty good shape. So Liza is our occupational health manager. She's also in charge of wellness and more recently our walk-in clinic manager. And so Liza does wear a number of hats. She is also on the incident command team. And we'll learn more about some of Liza's responsibilities as we go on. I want to talk a little bit about just a couple things. Some of it might be a reminder or just a point of emphasis. It was kind of interesting. Yesterday, I was on a call with the Iowa Hospital Association, and also was joined by a consultant that we had, and working with both us and the Iowa Hospital Association. And that consultant happened to reference the same site that we did yesterday. And so I'm going to repeat that and give you a little bit of a glimpse into that. It is the IHME website, and it's at healthdata.org. And if you're interested in COVID-19 projections, that's a pretty good site to look at. And it is the site that this consultant is now using as well. And just as an example on some of the severity of the impact to the healthcare community, the state of Minnesota is currently losing $31 million per day in revenue during this outbreak. So that's going to get anybody's attention anytime. I don't happen to have the Iowa number, but it's not going to be a lot different than that. And so healthdata.org will give you some of these projections. Again, it's an important time, and I'm sure Liza will emphasize this too, is that these projections assume social distancing is continuing. And we're going to hammer this until we're done doing these briefings about how important social distancing is and are for us to continue to meet these projections. We're having an impact with it very clearly, and we want to continue that. One of the things also that I want to mention is about senior care and the impact that social distancing is happening is causing at specifically our nursing home. It's really hard on those folks. Hard on staff, hard on our activities folks, hard on everybody. And so we're very aware of that. We're trying to do a number of things to relieve some of the pressure on those folks. For example, this afternoon we'll be having communion administered at 2 o'clock, kind of a way to maybe change daily patterns a little bit for them. And something that hopefully is very meaningful to them. One of the things that we have to be careful of, and this is just kind of a caution at this point, is putting things on residents' windows. Most of them enjoy that. Most of them like that. Most of them find some excitement in their daily routine for that, but not all. And some of them, quite frankly, react fairly severely to that in terms of something different and why is that on my window and things like that. So I would just ask that if you want to decorate windows or put something on somebody's window, we appreciate the good intention. Maybe give them a call ahead of time and say, is there somebody we should avoid, or something like that would be helpful. And so again, we thank all of our community members for doing things like that, but sometimes it doesn't have the impact that you would expect or that you would hope for. We're having similar issues at Landsmere Ridge, just in terms of the collective weight that social distancing is having. And so we just ask for family understanding of that, for grace during this period, because the one thing that we know we're not going to do is do everything right. And so we ask for grace. Many of us, most of us have never been through a pandemic before. So, we're experiencing all of this together. Together we will get through it. And again, we just want to really mention the social distancing aspect of this. One of the key aspects of social distancing is the wearing of masks. And so that we're now in Liza's power alley, okay, in terms of masks, what's going on. She's been leading a lot of effort in the community drive and response and in the securing of PPE for our organization. So Liza, could you talk to us a little bit about particularly the masks that have been made and how they're going to be used and where in our organization?
So we do feel like we are well prepared for increases in numbers and people who get sick. So we do feel we're well prepared there, but we want to conserve our supplies. We have been very appreciative of the community making this own masks. It's been wonderful to see the colors come in and the time and the effort and the care taken. So how we're using these, because we have recently gone to daily masking of anybody who has patient contact, these masks become a buffer to the mask that you would wear. So we put our personal protective equipment, which is a surgical mask, which is flexible, inside of here. These can be rewashed, and they make our personal protective equipment, our filters that we have here at the hospital, go longer. They allow our supplies to extend further. These also provide a very colorful, warm look to them as we greet patients who may not, may be a little worried about what's out there, and they provide a degree of safety and then provide a colorful distraction to some of what's going on.
Yeah, they're just a softer, and I think the thing is, if you mentioned this, maybe I missed it, but a large application of these is in our senior care environment, particularly because of that softer impact. And also, this took me a couple days to internalize a little bit, but when we actually put a surgical mask inside this, it does preserve that surgical mask down the road and puts another layer of protection in there too. So these are greatly appreciated, and
many of our seamstresses have stepped up in the community. Sometimes it's a lost art of sewing, and it's been great to see that there are people who still hold those skills, and it's been of great value to us. Michelle Voss has reached out to several of people that she knew, and I can't name all of you who have given masks to us. We continue to get them in, and we are very appreciative. And the Olsen model or the pleated masks are great, and we're very thankful for them.
In fact, when I walked in this morning past the table that these are put on, there were 2 plastic bags with masks in again. So again, we're very grateful for that. Hand sanitizers. I know there's some folks that are running a little low on hand sanitizer, folks as in healthcare entities. Where are we organizationally with hand sanitizer?
One of the first supply needs that we saw a disruption in was our hand sanitizer. And in our planning, we didn't want to get to the point where we didn't have any, and we used our resources sparingly, but we needed to reach out for another source. And West O Brewery, or the beer maker in Okoboji, was making hand sanitizer. So we bought 25 gallons from them. Nate Huizinga, who is the county EMA manager, was able to go pick that up and bring it to us. The same day he brought it, we did get a small shipment in. At the city incident command meeting, they mentioned that they were short on hand sanitizers. We were then able to pay that forward and give some of our extra supply to them. So there's a lot of hands working together to make sure that there's enough resources.
No pun intended.
Yes, no pun intended. So it's been great to see the community effort, whether it's in the county, the city, of all trying to get through this together.
Excellent. So we're in really good shape with hand sanitizer. So that's good. You mentioned Nate Huizinga. Could you talk a little bit about our relationship with the county and emergency preparedness? And there's a lot of stuff that goes on that are just kind of under the radar for folks. Could you talk a little bit about that?
So one of the things I was given a job, one of my other extra tasks, was the emergency preparedness plan here at the hospital. And in part of that is the group that meets. It is all 4 hospitals in our county, Nate Huizinga, who's the emergency manager, and community health partners. And we prepare for items such as this as best we can, whether it's stocking of supplies, sharing. So we meet quarterly. Now, since the COVID-19 pandemic, we are meeting weekly. Every Friday, we discuss what needs do we have, how can we share, how can we get together. And that has been we have a really close relationship, which is nice and very needed in times like this.
Very much so. That's great. There's a lot of heroes out there, and certainly our sheriff department is no exception to that rule. Thank you. Appreciate that. One of the things that I haven't mentioned today is our daily scoreboard. And for those of you at home keeping track, today we are at 47 tests that were performed here. 3 of those tests are positive, so we've had no new positives for the last while. 43 are negative, and we have 1 that's currently pending. So again, 47, 3 positive, 1 pending, 43 negative. We'll continue to give you those numbers as they're available. A couple final things that I have. We continue to screen all of our medical staff. Everybody, all staff that come into the organization are screened with temperature and questions. And the hand hygiene and other hygiene that's practiced here make this environment as safe as possible. Not only that's important for all of our workers, all of our employees, but it's also important for all of our patients and those accompanying the patients, that this is as safe of an environment as we can have. We want to protect and promote social distancing as much as possibly can, but we've run into a few instances of people that really had a medical need that they were not following up with because of, in some respects, fear of coming into the health system. We really would caution folks against that. We understand on the maintenance kinds of preventive kinds of medicine, certainly you can wait with that. But we're here, we're as safe an environment as we can have it today, and just wanted to communicate that with you as well.
Our staff has often commented that we feel very safe here, and we feel like this is one of the safest places.
Excellent. And the last thing that I have for today is that we won't be seeing you tomorrow. We're going to take tomorrow off from the briefing. We'll be back on Monday again with the briefing to go through the latest things that happened over the weekend. Again, certainly update on, hopefully there's no change in the scoreboard at all, but most likely there'll be some tests over the weekend. Certainly hope there's no more positives, but if there are, we'll deal with those as professionally as we have with the others. And again, a reminder that we will get through this together. So thank you again for joining us, and we'll see you on Monday.